what I wanted to do was just take some time now to give all of you a chance to hear from me directly, and I'm going to call on some members. I'm going to call from some of the groups that were participating as well. I'm not going to be able to get to everybody, and since he got such a weak reception when he walked in, I think that it's only fitting that we give Ted Kennedy the first question. So we've got a microphone here, Ted. Go ahead. Or comment. It doesn't have to be a question.
Thank you very much, Mr. President. I join in welcoming or seeing all of you once again in this very special gathering. I join with all of those that feel that this is the time, now is the time for action. I think most of us who have been in this room before have seen other times when the House and the Senate have made efforts, but they haven't been the kind of serious effort that I think that we're seeing right now. If you look over this gathering here today, you see the representatives of all the different groups that we have met with over the period of years. I mean, you have the insurance companies, you have the medical professions, all represented in one form or another. That has not been the case over the history of the past, going all the way back to Harry Truman's time. But it is the case now. And it is, I think, a tribute to your leadership in bringing all these people together, and really a leadership of so many that are gathered here today. Just in a very brief look around, you can see representatives of so many of the different interests. It'll be hard to think of those interests being together and being as concerned and providing the leadership that they are, as they are demonstrating that kind of a commitment as we have today. What it does is basically challenges all of us to really do the best we can. And I know that you and all of your staff, I congratulate Max Baucus and my colleagues who have done such an extraordinary effort today. Just say that I'm looking forward to being a foot soldier in this undertaking, and this time we will not fail. Thank you very much.
I want to make sure that we are getting a good cross-section of views on this issue, so why don't I call on our Republican leader, Mitch McConnell, if you've got any thoughts or comments on the issue.
First of all, Mr. President, thank you very much for having this session today. I think it's useful, and it is significant, as Ted indicated, to have everybody in the room. I'm also among those, as you and I have discussed before, interested in seeing us address entitlement reform, and admittedly Medicare and Medicaid would be a part of that, but also Social Security, and particularly concerned about having a mechanism in place that guarantees you get a result. And I wonder where you see yourself and the administration now, for example, in supporting something like the Conrad Gregg proposal, which would set in place a mechanism that could actually guarantee that we get a result, if not on Medicare and Medicaid, at least on Social Security.
Well, I appreciate the question, Mitch. As you know, we had I think they can hear me through. As you know, we had a fiscal responsibility summit similar to the gathering that we've had here, although I have to say the attendance here is even greater. And what I said in that forum was that I was absolutely committed to making sure that we got entitlement reform done. The mechanism by which we do it, I think, is going to have to be determined by you, Harry Reid, Nancy Pelosi, and John Boehner, and the members of Congress. We've got to make certain that the various committees are comfortable with how we move forward. But the important point that I want to emphasize today is that on Medicare and Medicaid in particular, which everybody here understands is the 800-pound gorilla, I don't see us being able to get an effective reform package around those entitlements without fixing the underlying problem of healthcare inflation. If we've got 6, 7, 8% healthcare inflation, we could fix Medicare and Medicaid temporarily for a couple of years, but we would be back in the same fix 10 years from now. And so our most urgent task is to drive down costs both on the private side and on the public side, because Medicare and Medicaid costs have actually gone up fairly comparably to what's been happening in the private sector, what businesses and families and others have been doing. That's why I think it's so important for us to focus on costs as part of this overall reform package. With respect to Social Security, I actually think it's easier than Medicare and Medicaid. And as a consequence, I'm going to be interested in working with you. And I know that others like Senator Durbin, Lindsey Graham have already begun discussions about what the best mechanisms would be. I remain committed to that task. But if we don't tackle health care, then we're going to break the bank. I think that's true at the federal level. I think it's true at the state level. It's certainly true for businesses, and it's certainly true for families. Okay. Henry, do you want to just give a little feedback in terms of what you heard and any points you'd like to make?
Thank you very much, Mr. President. Let me just say that Senator Kennedy will not be a foot soldier in this battle. He has been the inspiration to all of us, all Americans who held out the dream that every American ought to have affordable, quality health care. And I want to salute him for that. Mr. President, by bringing people together, the different stakeholders, the people representing different interest groups, the Democrats and the Republicans, all of us together, I think you've given us an opportunity not to insist that we get all that we want, but to realize that we're part of a process. And that if we don't get everything we want, the alternative is not to do nothing, as you pointed out earlier, but to make sure that we've got the best system we can develop. And that has to be a system that includes all Americans in health insurance that they'll be able to hold on to if they are satisfied with it, or to be able to access if they don't have it at the present time. So I think this is a very useful meeting. Our breakout session was very on point, and I think it leads all of us to recognize that we have to work together. We all need to recognize there are going to be trade-offs. But if we don't get the trade-off exactly the way we want it, we've got to recognize there's a broader public goal and purpose. And your leadership, I think, is going to make this bill possible to get into law.
Thank you. Thank you, Henry. Is Joanne Emerson here? There you are. Good to see you, Joanne.
Thank you very much for having me here today, and thank you very much for your passion on this issue. Coming from a very rural, poor district in southeast and south central Missouri, I have so many constituents who have no insurance, nor do those who have insurance necessarily have access
to providers.
Particularly primary providers. And so for us together, all stakeholders, members of the House, Senate, Republicans, Democrats, business, labor, you name it, I think that's critical. And I hope that all of us from both parties will be willing to kind of take a fresh look and say, you know, if there are laws that we had on the books before, that they need to be opened up if we need to change the system. And I think all of us have to be willing to kind of give a little, if you will. And I thank you so very much, because for me, this has been a passion for all 13 years I've been in Congress.
Good.
Thank you.
Listen, I appreciate your point, Joanne. I want to amplify it. I think it is so important that all of us make decisions throughout this process based on evidence and data and what works, as opposed to what our dug-in positions may have been in the past. Because if we can at least agree on a set of facts, we're still going to have tough choices, but we're more likely to make good decisions on behalf of families. And so I want to be clear about my own position in this process. During the campaign, I put forward a plan for health care reform. I thought it was an excellent plan, but I don't presume that it was a perfect plan or that it was the best possible plan. It's conceivable that there were other ideas out there that we had not thought of. If there is a way of getting this done where we're driving down costs and people are getting health insurance at an affordable rate and have choice of doctor, have flexibility in terms of their plans, and we could do that entirely through the market, I'd be happy to do it that way. If there was a way of doing it that involved more government regulation and involvement, I'm happy to do it that way as well. I just want to figure out what works, and that requires us to actually look at the evidence and try to figure out, based on the experience that now has been accumulated for a lot of years, how can we improve the system? And I'm absolutely confident that there's going to be some low-hanging fruit. For example, the issue of health IT. I don't think there's any dispute between Newt Gingrich and Ted Kennedy that if we digitalize our healthcare system, we're going to save money over the long term, and we're going to reduce error and save lives. There are going to be some other areas that's not such low-hanging fruit, and there's greater dispute about what might work. But we have to keep that open mind that you called for, Joanne. That's going to be critical. Let me go to Max Baucus, and then Chuck Grassley. I want to get a sense of the folks on the Finance Committee. They're going to have some influence on this process. Just a little bit. Max?
Thank you, Mr. President. First, we've got some real luminaries in this room. Yourself, a few hours ago, you mentioned that President Roosevelt tried to accomplish health care reform. He's over there, right there in the corner. And I think you'd be very proud
The other
of
side.
what we're doing. That's fine. And the third luminary is sitting right to my right here. And I think, in the spirit of all three of you, this is a terrific opportunity. Second, the American public wants it. That's a no-brainer. We're at a time in American history when American people want health care reform for all the reasons that you mentioned. It is, as you mentioned, a moral and a physical imperative. There's no doubt about that. And you've started this process, I think, in very much the right way, namely getting us all together. A tone, a culture, a feeling of cooperation and a constructive ways, evidence-based, what's the science, what works, what doesn't work, practically and pragmatically. And the real key here is for us to continue that frame of mind, continue that attitude, and keep everybody at the table. This is all-encompassing. There are trade-offs everywhere. This is not a short-term tactical exercise. This is a strategic, longer-term plan here that has to be a uniquely American solution. We're not Europe, we're not Canada, not Japan, we're not other countries. We're America, with public and private participation. And there's no doubt in my mind, is tapping into the good old American can-do and entrepreneurial spirit, that we're going to find a solution. And the key here really is to keep it up for us to all stay at the table, keep an open mind, as we've seen how this works with that and so forth. This is clearly not going to be easy. There's a fairly steep learning curve for an awful lot of people that get this done. But clearly the attitude is here, and it is the frame of mind is here, the desire is here to do this in a very cooperative way. And I can't thank you enough for providing leadership to help make all that happen.
Thank you. Thank you, Chuck. Thank you, Max. Chuck?
Mr. President, thank you very much for this opportunity. From our breakout session, you'd probably get the idea that it's pretty easy to get done. We know it's very difficult to get done. But without that sort of feeling starting out, nothing would get done.
Right.
And I think you served with us in the Senate long enough to know that Max Baucus and I have a pretty good record of working out bipartisan things. Neither one of us or neither one of our parties get everything that they want. but we've had a pretty good record. I think only 2 bills in 8 years that haven't been bipartisan. And so we have a process in place that has hearings coming up, has a process of getting roundtable discussions, getting stakeholders in, getting authorities in, and we expect to have work on this in a committee in June. Maybe it'll sound a little ambitious, but if you aren't ambitious on a major problem like this that the country decides needs to be done, it'll never get done. So the only thing that I would throw out for your consideration, and please don't respond to this now because I'm asking you just to think about it, there's a lot of us that feel that the public option, that the government is an unfair competitor, and that we're going to get an awful lot of crowd out. And we have to keep what we have now strong and make it stronger.
Okay. Well, let me just, I'm not going to respond definitively. The thinking on the public option has been that it gives consumers more choices, and it helps keep the private sector honest, because there's some competition out there. That's been the thinking. I recognize, though, the fear that if a public option is run through Washington and there are incentives to try to tamp down costs, or at least what shows up on the books, and you've got the ability in Washington apparently to print money, that private insurance plans might end up feeling overwhelmed. So I recognize that there's that concern. I think it's a serious one and a real one, and we'll make sure that it gets addressed, partly because I assume it'll be very hard to come out of committee unless we're thinking about it a little bit, and so we want to make sure that that's something that we pay attention to. A couple other people I want to call on. I'm going to switch gears and get some groups in here, and then I'll come back to a couple other legislators. Karen Inani, there you are. Good. Why don't you wait for a mic, Karen, so that we can hear you. Karen represents America's health insurance plans.
Thank you, Mr. President. Thank you for inviting us to participate in this forum. I think on behalf of our entire membership, they would want to be able to say to you this afternoon and everyone here that we understand we have to earn a seat at the table. We've already offered a comprehensive series of proposals. We want to work with you. We want to work with the members of Congress on a bipartisan basis here. You have our commitment. We hear the American people about what's not working. We've taken that very seriously. You have our commitment to play, to contribute, and to help pass health care reform this year.
Good. Thank you, Karen. That's good news. That's America's health insurance plans. While I'm on it, why don't I call on Dan Danner, who's NFIB. Is Dan still here? There he is. Dan?
Thank you. Thank you, Mr. President.
Give us the business perspective.
Well, I'm honored to be here representing small business. We do think that small business has a key role in this debate, and for them, cost is still the top issue. And we very much look forward to finding a solution together that works for America's job creators. So we appreciate being here, and thank you.
Good. One thing I want to talk about, just this whole cost issue. I can't emphasize this enough. There is a moral imperative to health care. I get 40,000 letters, I guess, every day here in the White House. I don't read all 40,000, but my staff selects 10 every single day that I read and try to respond to as many of them as possible. It's a way of staying in touch with the constituencies that I had a chance to meet during the course of the campaign. I can tell you that on average, out of the 10, at least 3 every single day relate to somebody who's having a healthcare crisis. Either it's a small business that's frustrated because they can't even insure themselves, much less their employees. It's a mom who's trying to figure out how to insure their child because they make a little bit too much money, so they don't qualify for S-chip in their state. Heartbreaking stories. So there's a moral component to this that we can't leave behind. Having said that, if we don't address costs, I don't care how heartfelt our efforts are, we will not get this done. If people think that we can simply take everybody who's not insured and load them up in a system where costs are out of control, it's not going to happen. We will run out of money. The federal government will be bankrupt, state governments will be bankrupt. So I hope everybody understands that for those of you who are passionate about universal coverage and making sure that the moral dimension of healthcare is dealt with, don't think that we can get that done without, excuse me, it's a healthcare forum, so I thought I'd, model what happens when you don't get enough sleep. Don't think that we can, that's right, I'm talking to you liberal bleeding hearts out there. Don't think that we can solve this problem without tackling costs. And that may make some in the progressive community uncomfortable, but it's got to be dealt with. And the flip side is what I would say to those who are obsessed with costs, and this goes to the issue of Medicare and Medicaid reform as well. I don't think it is a viable option as a means of controlling costs simply to throw seniors off the Medicare rolls, for example, or to prevent them from getting vital care that they need, which means we've got to balance heart and head as we move this process forward. A couple other people I want to call on. How about Charlie Rangel? He has a tax committee that's important.
People have said that when I first came to Washington, George Washington had black hair. But I have to tell you, Mr. President, this is one of the most exciting experiences and opportunities. There hasn't been a year that we haven't talked about this. And you have brought all of these different stakeholders to read from the same page to show how important it is to our country. And I'm excited about it. Our speaker has made it abundantly clear that there may be a lot of people to blame, but it won't be our committee people. It won't be those of us who have jurisdictions. There's nothing that we would rather do than be able to say that we help for you to fulfill not just a campaign obligation, but a moral obligation. We all are indebted. And so, Senator Kennedy, this is a fantastic day. There hasn't been a time we haven't hoped that we could do this. And so we know that there's going to be a lot of problems. But we also know what you've created is a group of missionaries to make our political job easier so that when we have the problems, they won't have to say, what are they doing in Congress? They can go to our union leaders, our business people, our advocate for children, those that do want public program, and at least we would know that we're moving in the direction which our country wants us to do collectively. So I'm proud to be on the team.
Good, thank you. Is your counterpart on your committee here?
Yes, he is. Dave and I work so closely together. If we can keep the disagreements down, we'll be a hell of a team.
Well, what I meant, Charlie, was let's give him the mic.
It's tough in the minority, let me tell you.
Go ahead, David.
You do lose a microphone when you're not in the majority. But thank you, Mr. President.
Yeah.
Thank you so much for bringing us all together. I think much of what has been said I can agree with, and I think particularly the idea that we have an American solution. Mm-hmm. And certainly in America, the idea that a patient and physician make the healthcare decisions that affect them is certainly something we need to protect. Right. And I just appreciate the opportunity to be here. Look forward to working with you. There's so many things that we talked about that we had in common in terms of health information, technology, wellness. But we are going to have to figure out, just how much of our economy is devoted to health care. I mean, that's going to be a big issue we have to face. Right. And this cost shifting that goes on between public and private healthcare dimensions, and those are challenging things, but I look forward to working with you and your team on this.
Well, you raise a couple of important points. Number one, doctors, and I'm assuming that we've got somebody, and I'm going to call on them in a second, but I've got a lot of very close friends who are doctors, and the enormous pressure and strain that the medical profession is now feeling from a whole variety of sources is something that we've got to attend to in this reform process. We're not producing enough primary care physicians because the costs of medical education are so high that people feel that they've got to specialize. The issue of malpractice insurance is real, and if you're an OB-GYN, that is enormous pressure that you're having to deal with. One of the things that we've done in this budget that we're presenting is to finally surface what had been the fiction that we weren't going to give doctors higher reimbursements. We always did it in the end, we just didn't budget for it, and it caused enormous stress for them. Now, the flip side of it is if we're going to do more for doctors, part of what we've also got to say is if there are states like Minnesota that are providing as good or better care than other states and yet are keeping their costs lower, and Medicare and Medicaid reimbursements are better controlled, shouldn't we be learning from what those states are doing and then making that more generally applicable? And there may be some resistance on the part of providers to say, well, our circumstances are different in this state or that state, but this is what I mean when I say that data and evidence have to drive the process. If we can find better practices, then doctors have to be willing to learn from the experience of others in terms of controlling costs. They've got to be part of the solution as well. So since I'm talking about doctors, we've got Ted Epperly of the American Academy of Family Physicians. Is Ted around here somewhere? Sure. There we go. Go ahead. Got a mic right behind you.
Well, first, Mr. President, what an honor to be here and to be with all of you. Speaking on behalf of over 100,000 family doctors, we're ready to do our part. We very much believe that we need to expand coverage in this country to everyone, and we need to fix the workforce, sir, so that all those patients have a place to go.